we had an overview on peripheral vascular disease, and we said that peripheral vascular disease actually affects it affects the how do they call it? It affects the arteries more. Okay, the veins have a less business to actually do with this peripheral vascular disease. Okay, so on the basis of this, we'll be talking about the classification of peripheral vascular disease. Now, in the classification, we get to talk about the peripheral artery disease, okay, the one affecting arteries. I said that the one affecting arteries, there's plenty things to talk about it, and I will obviously get to talk about the peripheral venous disease. You understand? So it's just an overview, so guys don't really need to stress yourself on this. All right, you guys don't really need to stress yourself on this. Let's move. The peripheral artery disease, okay. You could have what limb ischemia. That's the blood supply to the limbs are basically occluded to the extent that you're having an ischemic condition. They could have an aneurysal disease. All right, aneurysal disease is basically, let me search the most. Aneurysm is balloon or weakening in an artery. Do you understand? Like, I say this types of aneurysms. Right, so basically there could be weakenings in the arteries. Then you have acute aortic syndrome. This one is affecting the aorta. You could have what cardiovascular syphilis. You could have Raynaud's phenomenon or disease. Okay, so now let's pick some of them and talk about them. For the aneurysmal disease, it could be the balloon or weakening of the artery could be at the abdominal aorta, right? You call it abdominal aortic aneurysm, okay? Then you have a thoracoabdominal aneurysm. Thoracoabdominal aneurysm is more of like, okay, it's affecting the arteries in the thorax, okay? Then for the acute aortic syndrome now, okay, you have an aortic dissection, right? Affect the aorta to the level that the aorta is being dissected. You could have intramural hematoma. You could have penetrating aortic ulcers, all right? Then for the Raynaud's phenomenon or disease, Raynaud phenomenon is a spasm of the digital arteries, okay, digits, arteries in the word digits, okay? It could be the upper limb or lower limb, okay? So there's spasm in them, which often is precipitated by what cold conditions and relieved by heat. Okay, so Raynaud's disease, on the other hand, occurs when there is no underlying cause, right? But if it is Raynaud's phenomenon, maybe there's an underlying cause. But if there's Raynaud's disease, then there's no underlying cause, right? So this is aortic syndrome. Okay, this is what we call aortic syndrome. So the Raynaud's syndrome, I told you guys that there's what due to lack of blood flow, your digits will be so pale, right? So, but your digits will be red when blood returns, okay? And this is basically due to what? A constriction in the blood vessel there. It affects Raynaud's disease or Raynaud's phenomenon affects about 5% of the population and affects mostly women. All right, so the condition is bilateral, okay? So the fingers are more affected than the toes in Raynaud's syndrome and Raynaud's phenomenon or disease. Then for the peripheral venous disease, it's just varicose of the veins, right? Your veins becoming balloon shaped, becoming weak. That's what we call varicose of veins, okay? Then there's also superficial or thrombophlebitis, all right? So you see varicose of veins, it will actually show on the skin, all right? There could be a zigzag, all right, to show on the skin, all right, that there's a weakness of veins inside. And if there's a varicose of veins, there will be abnormal blood flow in that vein, and there will be what deformed valves, right? The valves will not be able to keep the blood flowing in one way, so some blood will be regurgitating back, okay? So guys, that's it about the classification of what peripheral vascular diseases, classified into the ones affecting arteries and the ones affecting the veins. I'll be see you guys in the next tutorial.